You know that feeling when everything just clicks? Your mind is sharp, your mood is steady, your body feels like it's firing on all cylinders. That's not luck, that's what your body is capable of every single day. Now, I've looked into a lot of fish oil supplements, and honestly, most of them are mystery sourced, overprocessed, blasted with heat, and packed with synthetic add-ins. But this one is different. Omega-3 Rejuvenate from Big Bold Health starts with wild Alaskan salmon and cod, sustainably caught from some of the cleanest waters on the planet, and then it's processed at low temperatures to preserve what actually matters. We're talking about real omega-3s, naturally occurring vitamins A and D, and pro-resolving mediators, or PRMs, that help your body balance its own immune response. What does that mean for you? Clearer thinking, more stable mood, and real nature-based support for your heart and immune system. No shortcuts, no synthetic nonsense. And it was developed by Dr. Jeffrey Bland, a true pioneer in the world of complementary health. If you want to feel the difference, go to bigboldhealth.com/Hoffman. That's bigboldhealth.com/Hoffman and use code Hoffman for 20% off site-wide. Once you feel it, you'll know. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. It is a special podcast because, well, not that special because we do it every week, but I find it special opportunity to answer your questions. It's our weekly Q&A with Leyla, because on this podcast, Leyla joins me. We independently do podcasts which appear at drhoffman.com, but once a week we get together to answer your questions. They say that two heads are better than one. And I certainly agree, because some of these questions throw me for a loop, and, you know, I require a little bit of a nutritional assist. And conversely, when we get into some deep medical terminology, you know, maybe that MD degree pays off. So, you know, we complement each other. And so how you doing, Leyla?
Okay. It's a little on the warm side, but I'm comfy. How are you doing?
Good. I'm hanging in here. I'm actually at the beach this month, and
Lovely.
I'm fully working.
Beautiful.
I'm doing my radio show and podcast, but you know, in a little bit of a cooler setting, and you got the whole family out here with me, and we're having some
lovely.
nice grill and some communal meals, and you know, kids in our family are going to camp. And everybody's having a great time. So it's a nice way to spend the month of July. Before everybody has to get back to the grind. So, good stuff. I just wanted to do a little bit, clean up on L3 from last week. A couple of questions where I wanted to revisit them. We had a question, it just came up. I don't know if it was a question. It was about the role that coffee plays in rehydration.
Yes.
And, you know, important for me because one of my major sources of rehydration when it's hot is I brew up, when I make coffee, I make like 5 or 6 cups in, the coffee machine. And, you know, I'll let it cool down so I can throw a couple of ice cubes in there or sometimes I'll reheat it in the microwave. I just like the taste of coffee, but I do decaf.
Yeah.
And so I'm not, you know, otherwise that much, you know, caffeinated coffee, I'd be vibrating.
You'd be vibrating, right?
Yeah. So I don't need that. You know, my one source of caffeine is you have a cup of tea in the morning with caffeinated, and that's a little lighter. So the question is does coffee dehydrate you? And I think we're both on the same page, is that coffee does not dehydrate you. I think some people take it to an extreme. They say, well, it's counterproductive because you're drinking, but it makes you pee, and hence it's a net loss of water. And it turns out that that's not the case. Now, you argued that coffee is a diuretic. Yeah. And I made a distinction. I said, no, I don't think it's really a diuretic. I think it's just a bladder irritant. And when you have, when coffee or even decaf hits your bladder, you want to pee more.
Yeah.
And it turns out that, Bill, you were right, that it turns out that coffee and caffeine in particular is a bit of a diuretic.
Hmm.
But net, uh, coffee or decaf is a pretty
Hmm.
good way to rehydrate in hot weather.
Yes, it's
So,
still a source of water.
yeah.
So absolutely, it's provides similar hydrating qualities to water. I think with caffeine, there's a mean urinary sodium excretion that's higher
Oh,
in
okay.
high test coffee, in caffeinated coffee, and that really would kind of be a difference. But it also depends on habitual coffee drinkers, and they build up a tolerance
Yes.
as well. And of
As I
course,
reach for
it
my decaf here.
yeah, and it totally matters whether it's decaf or caffeinated. So we're really talking about caffeinated coffee in this instance.
Okay.
So
So
there
less of
is
an
a
effect from
tolerance.
decaf, but I do
Yeah.
notice that it's probably not the greatest idea for me to have a cup of decaf like right before bed because
Oh yeah. Yeah,
but
yeah, yeah. My husband finds that out too. It's like, what are you doing after dinner? Having a cup of decaf. Are you sure you want to
yeah,
have these?
no,
What are you
I
doing?
love it because it in lieu of dessert, it's like
Yeah.
tasty and it kind
Yes.
of caps off the meal,
Right.
and
Right.
without sugar or cream, it's
Right.
just
Yeah,
has
yeah,
a
yeah,
nice
yeah, yeah.
taste and it's kind of like
Yeah.
the
The key is to eat dinner earlier, like at 4 o'clock.
right,
Have your cup by 5 and be done. Just
yeah.
completely be done. I'm a big fan of the whole earlier eating thing. So
Well, as I
anyway,
told you that I have a little bit the need to have a little bit in my tummy
sure.
before not maybe directly before bed, but reasonably before.
Yeah.
So I'm
Yeah.
not
You don't
feeling
want to go
hunger
to
pangs.
bed hungry.
Yeah, right,
Right, right,
right.
right.
It's like okay. So then
Hmm.
the other cleanup that we want to do is
Hmm.
just an addendum. Is we're talking about, and this kind of segues to the coffee at night. We're talking about strategies for reducing middle of the night wake up, particularly
Yeah.
for men, but also for women. And we did talk about managing your hydration and avoiding excess fluids before bed, and we talked
Hmm.
about some natural things. But we also have to talk about the medication side, and there are
Yes.
medications that control urination, and among them are medications that have an anticholinergic effect on the bladder, and
Hmm.
that's particularly when they're used in seniors, and seniors are the ones who have more bladder problems. Anticholinergics actually
Right.
are kind of like brain robbers. They have
Yes.
the potential to hasten cognitive decline,
Yeah.
and so the side effect is not desirable. Now,
Yeah.
these have been replaced with more, shall we say, targeted medication, alpha blockers and selective alpha blockers that may be a little better at avoiding the side effects. But in a
Hmm.
recent review of one of the more popular medications, I think it's called, uh, you mentioned Detrol. I'm not sure if Detrol is one of the old-fashioned medications,
Yeah. Detrol LA
but
or
Flomax is very commonly
Lomax.
is Flo.
Yes.
Yeah,
For
Flomax. I
men.
think less in the way of side effects, but also, according to a recent study, not that efficacious for middle of the night wake up. And
Hmm.
so we did mention melatonin as something that can kind of deepen sleep, so that in effect you don't pay as much attention to the signals coming from your bladder. Like
Right.
I mean, I got to say that, I, during the course of 7 or 8 hours during the day, I'm going to go to the bathroom. I
Sure.
can't remember the last time when I was able to go 7 or 8 hours during the day without going to the
Yeah.
bathroom.
Right.
So
Yeah.
it's
That's
it's
too
it's
long.
it's
Yeah.
it's kind of a tall order to expect that with the same bladder capacity, you're going to go to sleep and you're going to sleep uh, uh, deeply and soundly, and then
Hmm.
without a wake up,
Right.
especially if you're an older male or a woman.
Hmm.
With women, their problem is they don't have a prostate, but their bladder may shrink because of
Hmm.
the loss of estrogen. Estrogen
Yeah.
actually causes bladder capacity to
Mm.
supports bladder capacity. Without the estrogen, you have so sometimes women are given a topical estrogen,
Yeah.
vaginal estrogen or
Yeah.
systemic estrogen that can
Hmm.
actually help alleviate that problem. Okay, so there's another solution, which is a
Hmm.
completely different kind of drug. And the
Uh-huh.
way I found out about this is when I went to New Zealand with my elementary school friend,
Uh-huh.
who's approximately the same age as me. He's a couple of years older because I skipped a grade. And we were talking about waking up at night. Did you have a good night? Did you wake up a lot? And he said, no, he said, my doctor gave me this medication that really seems to help a bit. And I said, oh, really, what, can I see the bottle? And he couldn't remember the name. And I said, oh, it's desmopressin. Now, desmopressin was originally used for kids who wet the bed. And it is arginine vasopressin. And vasopressin has something to do with fluid management. It works not on the bladder, it works in the brain for, I guess in the hypothalamus, which regulates fluid dynamics to send signals to the kidneys, whatever. And in effect, you somewhat retain fluids when you take that. And he says it helps. And certain urologists are now hip to this, are now offering this as an alternative to some of the medications that are the bladder medications that have side effects.
Right. And it sounds like this is a more natural approach. Well, even though it's medication.
Yeah, I mean, it works on a natural pathway.
Yeah.
I guess the downside is that it can cause too much water retention, and because the water may accumulate, I don't know, maybe potentially, and give you some edema. And so you have to be careful. Also, when you accumulate fluids and you don't match the fluids with sodium, you can become hyponatremic. Low sodium makes you feel sort of weak and woozy and can even be serious and, result in, you passing out. So that is an option. And, I think it might be a tip for men to ask their doctor or ask their urologist if they could do a trial of therapy with the desmopressin if that middle of the night wake up is plaguing them and robbing them of restorative sleep.
Yeah.
I got to say that, I do wake up and, usually once, but I have the ability to go back to sleep mostly, unless there's really, really, really something on my mind, like something really bothering me. Then it just pops in my brain and I start to then I have to kind of overmaster that and I kind of maybe read a little bit or something. That's rare, but I have really, so last night I went to bed at I think I went to sleep at 10:30. I slept till 7:30.
Fantastic.
An exceptionally long bout of sleep. It was very restorative. And I guess it was tired from, exertions or the week or something. Right. And so
I might wake up once in the middle of the night, rarely twice. It would have to be kind of a late-ish dinner, late-ish, all of that.
Yeah.
And I rarely have anything caffeinated after breakfast or even after 11 a.m. or anything like that. My limit is generally 3 cups of coffee, rarely 4 if I'm really not. Sometimes I'm just not feeling the caffeine at all, which is strange. I don't know why. But no, my sleep is pretty deep. I will wake up maybe sometime after 3 a.m. to go to the bathroom, come back. By that time, the most restorative sleep has already happened, which is typically happening between 11 p.m. and 2 a.m., which is important.
So you get a bonus round later.
Yeah. Something like that. Right. Exactly. So it's good that there are things that people can take like this desmopressin. Yeah. And that coffee.
And by the way, I invite people, if they are taking it or if they plan to try it, give us some feedback. Did it work for you? Was it helpful? What are your sleep solutions? We'd like to hear from you, from our listening audience, because this is not just questions. It could also be comments, share something with our listening audience that's worked for you.
Yeah. Okay. Dr. Hoffman, I think now might be a good time to hear from one of our sponsors. What say you?
Let's TCB, take care of business, and allow one of our sponsors an opportunity to share an important message before we get to our actual questions. Questions come to questions@drhoffman.net. You know that feeling when everything just clicks? Your mind is sharp, your mood is steady, your body feels like it's firing on all cylinders. That's not luck, that's what your body is capable of every single day. Now, I've looked into a lot of fish oil supplements, and honestly, most of them are mystery-sourced, over-processed, blasted with heat, and packed with synthetic add-ins. But this one is different. Omega-3 Rejuvenate from Big Bold Health starts with wild Alaskan salmon and cod, sustainably caught from some of the cleanest waters on the planet, and then it's processed at low temperatures to preserve what actually matters. We're talking about real omega-3s, naturally occurring vitamins A and D, and pro-resolving mediators, or PRMs, that help your body balance its own immune response. What does that mean for you? Clearer thinking, more stable mood, and real nature-based support for your heart and immune system. No shortcuts, no synthetic nonsense. And it was developed by Dr. Jeffrey Bland, a true pioneer in the world of complementary health. If you want to feel the difference, go to bigboldhealth.com/Hoffman. That's bigboldhealth.com/Hoffman and use code Hoffman for 20% off site-wide. Once you feel it, you'll know.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear Nasal Spray is available at retailers nationwide and online. Check out Xlear.com for our special offers. That's Xlear.com.
Thanks for listening, and thanks for supporting our sponsors. They're what make intelligent medicine a continuing free resource to you. And now let us start answering some questions.
Well, Dr. Hoffman, as you know, it's been in the news, and a lot of people are wondering, what is aortic stenosis?
What is it?
Can you
mean,
speak to
in
that?
relationship to
Lindsey Graham.
Lindsey Graham. Okay, so this is, I think, a very scary thing, is that you can walk around and have inside you a ticking time bomb, and that can not only, because heart attacks these days are often survivable, but this is a calamity, and I've looked at the statistics on this. Very, very grim prognosis for an unwitnessed, because I think he was home alone, aortic dissection. And, okay, so what we're talking about, people said, well, you died of a heart attack. Well, broadly speaking, it was something, an attack that affected his heart. Yes, a form of attack, but it's not a myocardial infarction. And what a heart attack is when one of the coronary arteries gets blocked. And when one of the coronary arteries gets blocked, and there are, I guess, three main ones and some subsidiary ones, that a certain part of the heart doesn't get blood, and that part of the heart begins to die. And then you either have decreased pumping action or an arrhythmia, and that's what can kill you. Certainly that causes, there are warning signs, there's pain, and, herald a heart attack, and then, you can call 911, and then they can save you by revascularizing you, by opening up the artery and, administering proper medication. Okay, this was different. This was something that affected the aorta. And there's a couple of ways that you can have a life-threatening problem with your aorta. You can have an aneurysm, and think of, I have a bicycle that has an inner tube, and think of a weakening part in the inner tube, and sometimes that bulges out, and you can see that. And the more it bulges out, the more likely it is to pop, right? So with that would be a burst aneurysm, and one of the very catastrophic things that can happen is you can have a AAA. It's a abdominal aortic aneurysm. That is below the heart. That's where that main artery, which is your aorta, goes down and feeds your abdominal organs and your lower extremities. So it's a big pipe. And when that pipe bursts, it's pretty darn serious. But people can be saved from that.
Yeah.
I think you got about a 50-50 chance of surviving one of those. But what they'll do is they'll patch it up. They'll actually sometimes take out a part and put in Dacron, which will fix that. So those can be predicted because sometimes they'll get picked up. Actually, on physical exams, sometimes you can hear in the abdomen, which is where you should be hearing it from the heart. A heart valve might cause that whooshing sound. But if you hear that, and sometimes you feel a pulsation in the abdomen, it's a little hard, especially nowadays. People don't rely so much on physical exams. They rely on more imaging. So with an X-ray won't pick it up, but a CT scan will pick it up, or an MRI will pick it up, and you'll see a bulge in your aorta. And then they will say, well, people sometimes call in with questions, like, I have this, what should I do? And if it's a certain size, they don't do anything. They observe it. They keep monitoring it. But it keeps expanding. They'll do preventive surgery to make sure that they patch it up before it bursts. Okay. Then there's the upper aorta, which is coming out of the heart. It's going north. It's going towards your head and your brain. And, oh, by the way, the aorta above the heart branches off and feeds the coronary arteries that go back to the heart. So you got a problem with your upper aorta, and the blood's not going to get to your brain, and the blood's not going to get to your heart, and that's disaster.
Yeah.
Right? That's end game. So coming back to the bicycle analogy, the aorta is a muscular tube that has a lining. And some people have problems with the lining where the lining tears away. It's called a dissecting aortic aneurysm. And it's not so much that it explodes outward, but it kind of rolls up inside like a window shade. And then it attracts blood clots, but it also prevents circulation. And that sometimes you get a little warning that it is beginning to shear off. And, you get distress and pain, often pain radiating to the back. And then you can go to the hospital and say, oh my God, you have an impending dissection. And then they actually cut out that section and replace it. Big operation. You got to go in a heart-lung machine, but maybe 30% mortality, 25% your mortality, but it's a big deal, but they can save your life. Evidently, Lindsey Graham did not have enough time or, they had trouble even getting into his house. He made a distress call, and then somebody said, go to the house, the door's always open. The door wasn't open. They had to break down the door. So they did administered CPR. He was already too far gone. So what could cause that? A lot of people are saying, maybe I have this ticking time bomb in my body. So just atherosclerosis alone can sometimes cause this, but it can also occur in people who don't have atherosclerosis. Now, it is noted that the father, Lindsey Graham's father had this. So there's a hereditary component to this. I also remember that there was a host on a previous radio station that I was on, WOR, and they had this show called Rambling with Gambling, which is a 3-generation thing. It started with like the radio in the 20s. It was the grandfather and then the son. And then the grandson was the host that I interacted with, and he's since retired. So it gives you an idea of how long ago that was.
Okay.
So, but the middle gambling had died of this type of dissecting aneurysm.
Wow.
And so the son was always screened for it. He was always screened for it. And so if you have a family history, that it really calls for you to be screened. There is this condition called Marfan syndrome, which is the syndrome of extreme laxity of joints. People can bend their fingers back to their wrists, and they often have a kind of a very wide arm span and a little bit, I think some of the fashion models may have Marfan syndrome. They're just like, that's a fashionable look.
Mm.
Thin torso and long fingers and long limbs. And
Okay.
that is associated with a collagen defect, which renders you more susceptible to dissecting aortic aneurysms.
Wow.
Short of that kind of rare syndrome, I had a patient who had that. By the way,
Marfan's.
she was very famous. She did a lot of voiceovers for, some
Mm-hmm.
really important shows. She was getting screened for for aortic abnormalities. And so also,
Mm-hmm.
you have this thing called Ehlers-Danlos syndrome,
Oh,
which
yeah.
is now it's very interesting because
The
it used to be
connective
like
tissue.
yeah, exactly. Uh, it's a whole complex of symptoms that are related to connective tissue problems, and there are different types: type 1, type 2, right? And I got to tell you, I don't know jack about Ehlers-Danlos because it's complicated. It is now
Yeah.
theorized that it's not like you have it or you don't have it. It's that there's kind of a spectrum that some
Oh.
people may have a form of Ehlers-Danlos syndrome, which is unbeknownst to them,
Mm-hmm.
renders them more susceptible to these types of problems.
Okay.
Anyway, just
Okay.
parenthetically, and of course, there's these conspiracy theories that he just came back from Ukraine. And what did that have to do with it? He just signed like some kind of deal with the Ukrainians, and maybe the Russians offed him.
Oh boy.
I don't really. I mean, people
Yeah.
always reach for those things. Um,
Sure.
the so it's is it conceivable that the stress and the jet lag, may was like the straw that broke the camel's back? I guess
Yeah.
possible.
Yeah.
Because he was subject to a lot of stress. Did
Yeah.
that set off the vulnerability that he had? Maybe.
Okay. All right. So as a prerequisite, it could be hereditary, it could be Marfan's, it could be Ehlers-Danlos. What other anything is a risk factor
Yeah.
for it? Would it be like very high blood pressure? Could that
Yes,
cause an
yes,
aortic
yes. Sure,
dissection?
sure. Yeah, poorly controlled blood pressure is a feature of that damages the aortic
Okay.
lining. And so
Okay.
poorly controlled blood pressure, you certainly, if you have an aortic, when you have any kind of aneurysm, blood pressure
Yeah.
control is really important because you're putting stress on that weakened
Yes.
kind of outpocketing. I'll mention
Yeah.
another syndrome, and I don't want to impugn Lindsey Graham because this is not the case with Lindsey Graham. This is more of a 19th century disease.
Hmm.
And I'm old enough to remember that we did pay attention to that because uh, when I started medicine, it was conceivable that we had people who were young during the pre-antibiotic era. And in the
Mm-hmm.
pre-antibiotic era, people got syphilis and there was nothing you could do for it.
Ah.
And they developed, there's three stages of syphilis. One is a genital syphilis. You have like genital lesions. That's
Yeah.
the initial stage. The second stage is secondary syphilis, where you get like these rashes all over your body. And the
Hmm.
third stage, and by the way, it's a spirochete like Lyme disease.
Yes.
And
Yes.
the
Hmm.
third stage, like Lyme disease, it can affect the brain. And people
Wow.
were getting, insane asylums were populated with people
Wow.
who had tertiary syphilis that they couldn't treat. They were
Mm-hmm.
going gaga with, advanced syphilis. But also, another feature of it was dissecting aortic aneurysms. Again,
Wow. From
not to
syphilis.
impugn,
Hmm.
like some people are going to
Yeah.
say, like, was he like engaged in some, sexual escapades? I'm not saying that.
It's
That's
an
not.
STD.
Yeah,
That's
yeah,
yeah.
yeah. But no, this is not the case with
Yeah.
Lindsay.
Yeah.
But it is, it's part of what's called the differential diagnosis. I think that's disappearing in the 21st century because anyone who gets syphilis gets a diagnosis of syphilis. It's hard to miss a case of syphilis. We actually had very interesting. We had a case of syphilis,
Yes.
and it was
We
not in
did.
like some kind
Hmm.
of homeless person. It was like an
No.
upscale guy who came to our office, and he had some skin lesions. And I said, "Well, what's going on?" And asked him some questions, and the history came out
Hmm.
that he may have had some unsafe sex, whatever. And then he turned out to have had at least not the kind that affects the brain yet,
Yes.
or the kind that affects the
That
heart.
would be a late
Yeah,
stage,
late
right? When
stage.
it
Yeah.
becomes
So, but
and dementia.
now, according to some news stories these days, syphilis is making a comeback.
Yeah. And I believe it's being screened for more often, Dr. Hoffman, especially in the setting of dementia or mild cognitive impairment
Hmm.
or anything
Hmm.
like that, that it's
Yeah,
something that's being looked at,
it should
which
be
I
looked
find
at. It
fascinating. It
should be
should be,
looked at.
right?
It should be. I mean,
Everything should be ruled
you
out.
got to tick that box because if
Sure.
you miss it, it's like it's a treatable thing. And
Yeah.
incidentally, this kind of keys into a podcast that I just recorded yesterday, which is a podcast about how, in some cases of Alzheimer's disease, you can have an infectious cause. Now, we know that gum disease is associated with Alzheimer's.
Yes.
We know that certain viruses may be associated, like herpes virus, may be associated with
Hmm.
Alzheimer's.
Hmm.
Even Epstein-Barr virus may be associated with
Right.
MS. We know, and so
Mm.
infectious causes of these neurological diseases, and finally, there's also Lyme disease, of course,
Yeah.
that is sometimes poorly diagnosed, and Lyme disease can cause cognitive problems.
Okay.
It's a spirochete, just like syphilis. It's the same family. Yeah.
Yeah. That's fascinating. Yeah.
So anyway,
Anyway.
just a
Okay.
really terrific guest who heads up this whole scientific enterprise trying to pull together clinicians from many fields,
Mhm.
researchers and doctors who are looking at these complicated patients. And she herself can attest to this because she was super sick. Went to many doctors. They kind of poo-pooed it and gaslighted her and said, maybe take a anti-anxiety pill or tranquilizer. And it
Wow.
turns out that she had many co-infections, Lyme disease and co-infections, and only when she was treated for it did she
Hmm.
recover. And I mean,
Wow.
if she's suffering from cognitive decline, man, I don't know. She was like really a firecracker,
Okay.
very, very
Yeah.
cognitively sharp after
Hmm.
proper treatment.
Yeah. It could be shocking to witness somebody that sharp being in such decline
Yeah.
with something like that. But thankfully, it was something treatable. Yes. Wow.
So
Okay.
yeah, so that's kind of
Mhm.
like the celebrity disease of the week, dissecting aortic aneurysm. So what can you do? Does it pay to screen everybody for this? In other words, should
Mm.
everybody say, "Oh my God, Lindsey Graham just died. I'm going to go to my doctor and I want every test in the book to see if I have this."
Yeah.
Um, you know,
A lot of people will want to do that. Yeah.
yeah, this is a condition which is so rare. It's like kind of 1 in 100,000. And so
Okay.
would it pay to do everybody, CT, MRI to see if that's the case? Yes, if you have a family history. Yes, if you have one of these conditions.
Yeah.
But,
Marfan's or
you know,
Ehlers-Danlos. Hmm.
I mean, it just shows you that
Uncontrolled high blood pressure, maybe too.
we kind of have a precarious hold on life. When I first heard the story, I
Yeah.
said, wait a minute, you got the
Yeah.
name wrong. It's Lindsey Graham. No, no, no. It must be, you must be thinking of Mitch McConnell because that guy looks
Right.
like he's
Because
on
he's
his
been,
way out. Yeah. And
yeah.
it's like,
Yeah.
no, it's like the active, vigorous guy who just, is hobnobbing all around the world who just
Right.
dropped dead.
Right. Oh, my goodness. Anyway. Okay.
You
All right.
never know. You
You
never
never
know.
know. Life is, yeah. Yeah. Life is
Life is
capricious.
precarious, right?
Mm-hmm.
Okay, so
Mm-hmm.
when we return, let's tell us what our next question is going to be.
Yeah. Well, speaking of aortic dissection, I'm a longtime listener of Dr. Hoffman. I always valued his medical information. I live here in northern New Jersey, and I wondered, how do I find a preventive and integrative cardiologist in
Okay,
northern New
well, we'll
Jersey?
tackle that question when
Yeah.
we return. I'm Dr. Ronald Hoffman today with Leyla Muden because it is our weekly Q&A with Leyla. Yeah, we work together to answer your questions. Questions come to questions@drhoffman.net, and we'll be back with more in just a moment.